from Sanofi, from Dr. Nazem Atassi. This is a description of a phase 2 trial of a RIPK1 inhibitor in adult ALS. Welcome, Nazem.
Thank you, Dr. Bram. It's so nice to see you. And thank you, Jen and the organizers, for giving us the opportunity to present our work. So this is really an update on the phase 2 trial, Himalaya Trial of the RIPK1 inhibitor SAR 443820 in patients with ALS. So it's an update on the enrollment, design, and the baseline characteristics of the patients. Oh, let me go to presentation mode. I hope this looks good for everyone. These are the disclosures. So SAR 443820 is a first-in-class, orally administered, CNS penetrant, selective RIPK1 inhibitor that aims at protecting the motor nerves. It works at the intersection of inflammation and cell death, or inflammatory cell death, and I'll go over that in the following slide. We have completed actually a number of phase 1 trials in healthy volunteers, ranging from single ascending dose to multiple ascending dosages up to 2 weeks. The results of the phase 1 studies were conducted, supported going initiation of the phase 2 study, the Himalaya Trial. In these studies, we saw robust target engagement when we measured RIPK1 inhibition in PBMCs. And we measured the compound in the CSF in a subset of patients. And this compound is very CNS penetrant, almost one-to-one to unbound, to protein unbound between plasma and CSF. The phase 2 trial is a multi-center, randomized, 6-month double-blind, placebo-controlled study, followed by an open-label extension. We completed enrollment this last July in 2023, actually 2 weeks ahead of time, which was great. The trial is designed to assess the efficacy and safety of SAR 443820 in patients with ALS. A little bit on the mechanism. RIPK1 is expressed in all cells in the brain, neurons, oligos, astrocytes, and microglia. Has different functions in different nerves, different cells. In a neuron, you can see on the left, RIPK1 inhibition prevents inflammatory cell death, which is a combination of necroptosis and RIPK1 dependent apoptosis. When the nerves die, and through these mechanisms, both apoptosis and necroptosis, they release these DAMPs, which in turn activate microglia and astrocytes. In the microglia and astrocytes, RIPK1 activation leads to an inflammatory response with releasing pro-inflammatory cytokines, which in turn activate the RIPK1 pathway in the neurons. So you could see there's a vicious cycle happening here. And the goal of inhibiting RIPK1 is to stop this vicious cycle and hopefully protect the nerves and reduce the inflammatory response in the microglia and astrocytes. This is an overview of the phase 2 design, the Himalaya trial. The aim is to determine the safety and efficacy of this compound in people with ALS. This is a study with a 24-week double-blind period with 2-to-1 randomization. We have enrolled 305 patients in this study, so it's a pretty large phase 2 study. And after the double-blind period of 24 weeks or 6 months, patients have a long-term open-label extension for about a year and a half after that. The Part A and Part B is one study, so both the open-label extension and the double-blind are one study. So the primary endpoints for Part A is the change from baseline in the ALS-FRS. And for Part B, we will look at survival, and we'll look at the CAF score, which is the assessment of the combined function and survival. in addition to secondary endpoints, measuring breathing with SVC, muscle strength with HHD, quality of life, serum neurofilaments, safety, tolerability, and PK. We also implemented digital speech analysis in the study. The inclusion-exclusion criteria are relatively typical for ALS trials, more favoring kind of earlier onset patients, so less than 2 years of onset and more than 60% of SVC, able to swallow a tablet. And we excluded patients who are on treatment on other medication. There are strong CYP3A4 inhibitors or inducers. There are 19 sites in the United States, and it's a global trial. You could see that the patient breakdown based, per continent. So we have about a little bit more than half of the patients were enrolled in Europe, about 20% of patients in the US, and 25% of the patients in China and Japan in Asia. These are the baseline characteristics of these patients. So mean age, 56, 57 years old, 60% male, a little bit of male predominance. The race is 65 white and the 25% Asian, reflective of the global nature of this trial. Weight 72 kilograms, BMI of about 25. The ALS type of diagnosis, we have about 40% definite and about 31 probable ALS, 20% bulbar, and time from symptom onset about a year, and time since diagnosis is about half a year. And the baseline ALS FRSR was 36, and the baseline SVC, slow viral capacity, was 81. So relatively early patients and healthy patients in the trial. So in conclusion, this is a large phase 2 study with over 300 patients, aimed to assess the effect of SAR 443820 in reducing the progression of ALS measured by ALS FRSR, in addition to additional secondary endpoints. This trial is designed to generate well-controlled evidence, both for safety and efficacy for Part A, and a long-term efficacy and safety for the Part B, which is a year and a half after Part A. This is a global trial that enrolled a diverse group of ALS patients from 13 countries and 62 sites across 3 continents, Europe, Asia, and North America. And thank you for your attention.
Thank you. Thank you very much, Nazem. That's a very, very promising. And I love the fact that there is such a global reach in terms of trial site establishment. That's perhaps unique from trials I recall anyway, but that's fantastic. Let me ask, if I may, a question really about the sort of basic biology here. You've mentioned that that RIPK1 is expressed in almost every cell. And you've mentioned that, of course, and you showed the schematic, that when there are outside stressors that provoke inflammation, it becomes very important in initiating a couple of pathways that lead to cell death. My query is why we don't anticipate more side effects from its inhibition, given that it's so widely expressed. Is that because it's really essentially at resting state, not a really important molecule unless there is superimposed stress, such as an inflammatory process? Or is there some other reason why we wouldn't anticipate a wider adverse effect profile?
I think the latter, what you said makes sense, that when this pathway is activated, this is when the RIPK1 it takes its effect. So it is, cell death and inflammatory cell death. So if everything is going well, there's no activation of the pathway, there's no cell death. So it is kind of activated in a disease state, not in a kind of normal state. I mean, it could have some impact on, I don't know if in development on response to, infections and I'm sure that that pathway has some kind of a purpose, other than just inflammatory cell death. But I can tell you that in the current trial, we're looking at, rate of infections, rate of anything related to kind of immunity from a side effect kind of standpoint as adverse events of special interest. So we're looking very closely at, let's say lymphocyte counts and some other like, CBC with differential. We're looking at rate of infections and all of that in all the trial population. And obviously when we unblind next year, so the results of the study is expected in Q1 next year, we will have that data obviously to look at. But we have this in the back of our minds, is like, what is the kind of purpose of that pathway? And if we block it, are we kind of causing any kind of adverse event? So we're looking at that.
Thank you. Yeah, you've just anticipated another question in chat. Given the size of the phase 2 study, this is pivotal. When can we anticipate the top line data? And you're saying it's first quarter of next year, so that's wonderfully enough just around the corner. Is that correct?
Yeah. That is correct. Yeah, we're very excited to know the result of the study.
That's great. Good. Well, incredibly, I think we're a little bit ahead of time.